Ona thengia ya murimu wa COVID-19 guthie na mbere na gucenja muturire uria andu maramenyerete au kabere, andu guthie na mbere na kuona murimu uyu ni kionereria kieganu kia ati ona kunyitwo ni murimu uyu ti mwisho wa muturire. Umuthi andu 54 makiona murimu uyu, ino ario namba nene muno ya andu kuona murimu uyu muthenya umwe, namba ya aria mahonete ikirugamira 553.
These recoveries are attributed to the diligent and committed work of healthcare workers operating in enabled health systems. In our country, I am delighted to inform you that today we have discharged 54 patients who have recovered from coronavirus disease.
Kaunti ya Nairobi no ithiete na mbere na kwendekithia namba nene ya arwaru. Umuthi kiandikithia arwaru 48, igacokwo ni kaunti ya Mombasa na arwaru 38, kaunti ya Busia iri na arwaru 20, kaunti ya Uasin Gishu iri na arwaru 12, kaunti ya Kiambu na kaunti ya Nyeri ciri na arwaru 3, kaunti ya Kilifi iri na arwaru 2, kaunti ya Garissa na kaunti ya Laikipia ciri na murwaru 1 o kaunti.
The 44 cases in Nairobi are from Kibra 10, Westlands 9, Dagoretti 4, Embakasi West 4, Embakasi South 3, Langata 3, Makadara 3, Mathare 3, Kasarani 3, Ruaraka and Kamkunji 1 each. The 3 cases are from Nyeri Central 2 and Nyeri South 1.
Matereba a thabari ndaya ni mathite na mbere na kuhinyererio makoro magethimo mathaa 28 mbere ya kwambĩrĩria thabari ciao niguo gutiga gukorwo na muhatikano wa ngari mihaka-ini.
Of concern that there is now a build up of congestion of truck drivers at some of the border points, and this is because most of these drivers are not observing the protocols that have been put in place.
Mutafariri wa mihango ministry ni ugima wa mwiri Rashid Aman ni ahithuritie rimwe maumirira maithimini maracererwo kurekererio kuria mathimitwo, akiuga kaingi maramba guthima ithimi cia kundu kuria kuri ugwatini niguo gwithema murimu uyu ndugatambe na njira nene icigo-ini icio.
A backlog is common when you are doing expanded level of testing. It is natural, it happens, but the aim is to try to cut down that backlog as much as possible. Sometimes this backlog may be created not only by the sheer numbers of samples that you are collecting, but by other issues such as the logistics of moving those samples to different places.
Akenya ni mathiete na mbere na kuhinyererio kurumirira mitaratara iria igathikitwo niguo kuhota kuhotomia utheremia wa murimu uyu wa COVID-19. Gerifotera Kameme TV, Ritorokoni Wajiro wa Foro.